Bring these questions right now to the director of the CDC, Dr. Robert Redfield. Good morning to you, sir. Thank you so much for joining us. Let's start with what we heard from President Trump just yesterday there in the White House. He says it is going to get worse before it gets better. That is a somber warning. I don't need to tell you that. Exactly how much worse are we talking about? What should Americans be prepared for?
Well, you know, I think it's important to realize that this is the greatest public health crisis that our nation's faced in more than a century. I will say, though, we're new in learning about this virus, so it is very hard to predict. Clearly, though, we have a significant upsurge of the outbreak now. What I'd like to focus on is what we can do to counterbalance that. And I've said before, we're not defenseless. We have powerful tools. Probably the most powerful tool that we have is a simple face mask. If all Americans would embrace that as part of their personal responsibility to confront this outbreak, we could actually have a very significant impact on the outbreak that we're seeing across the country in the next 4, 6, 8, 10, 12 weeks.
And you tweeted,
so that's the first thing that I would encourage.
On those face masks, sir, you tweeted about them saying that they are part of your social responsibility. I want to ask you, so are seatbelts, so are laws against driving and drinking and driving. That's also part of social responsibility. Is a national mask mandate not imperative at this moment?
Well, I think it's really a question of how do you get the American people to embrace that social responsibility. Now, some governors have done it, you know, obviously with mandates. Other governors have done it through example. I think our key is just to let the American public know how important this is, how important it is that we wear these masks, wash our hands, and really if we did this simple acts, that we could, in fact, answer your first question. You say, what's the future hold over the next 4, 6, 8 weeks? I think largely it's dependent upon how we respond to our request to everyone to embrace their own personal social responsibility and become part of the solution by wearing masks, washing hands, and really thinking smartly about when they're in gatherings, that they don't get in crowded situations.
But health experts like yourself have been warning about wearing masks for a long time now, and yet we still see people resistant to that. So why not just mandate this nationally and make people wear a mask if it will save as many lives as you're saying it will?
Yeah, I'm not sure that mandating makes. I think the issue is how to motivate all Americans to do that. It's obviously an independent decision that the individual governors are making. I think at this point, you know, what we're trying to do is let people understand the most important public health measure that they can take to help change that question that you started that this could be getting worse before it gets better, is they could be part of making this get better before it gets worse by wearing a face covering, and that's what I'm going to continue to do. I think we have clear data now that face masks work, and we really now, the key is now how to get everybody to embrace them.
Returning to schools is at the forefront of the minds of so many parents right now. The CDC, you yourself have recommended social distancing in schools. Sir, how realistic is that really? Do you really expect first graders, kindergartners to stay 6 feet apart at lunch and on recess?
You know, I think it's really important to get our schools open. As I've said, it's not public health versus opening the schools for the economy. It's public health versus public health. I think there really are a number of negative public health consequences that have happened to our K through 12s by having these schools closed. And so it's so important now to work together with school districts to figure out how they can take our guidelines and operationalize them in a practical way, and to do it in a way that's safe for those that are vulnerable, particularly the teachers and those children. I have a grandson with cystic fibrosis, but I do think it's critical. And one of the most important things is going to be the role of face masks and the role of social distancing in those classrooms.
And would you be comfortable with your school-aged grandchildren going back to school in the fall?
Absolutely. Absolutely. The only one that there may be some reservation is my grandson with cystic fibrosis, depending on how he can be accommodated in the school that he's in. But my other 10 grandchildren, of those, 8 of them are school age. I'm 100% that they can get back to school.
Dr. Redfield, thank you so much for joining us this morning. We appreciate your time.
Well, thank you very much. God bless.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here. to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.